Next, I'm going to listen to her heart and lung sounds just to make sure they're not abnormal. I'll just have her set like this. And you start from one side. Have her take a deep breath. Out. In and out. And you go straight across and do it again. In and out. In and out. And you go down. Listen to the lower lobe. Right lower. And then you go to left lower. Her lungs sound good and clear. Then I'm going to go to the front and listen to the front side of them. We'll start with the right side. Deep breath in and out. Okay, again. Then I'm going to listen to her apical pulse just to make sure that she's perfusing, make sure I don't hear any abnormality beats. I'm also going to feel a pulse while I'm doing that just to make sure she's perfusing. You listen for a full minute. Okay, so I get 68, and then I'm going to check her blood pressure manually. You just always tell your patient what you're doing. At 120/76. And since she's female, I mean, obviously we're not going to do a complete assessment on checking, female stuff, but if you did her female stuff, I mean, you would explain to her everything that you're going to do. You would have her dress into a gown. Things that you would do was when you would choose a speculum, usually a plastic speculum, you would use the appropriate size, you'd use KY jelly. You would look at externally to make sure there's no lesions, the distribution of the hair, make sure, there's no type of abnormalities or swelling or anything on the outside of it. When you do your internal, you lubricate, put your speculum in with your glove finger. You tell the patient what you're going to do. You tell them that they're going to feel some downward pressure. You ask them to breathe slowly to kind of relax so that you can get through it. You wait till you feel her relax and you insert the speculum. You look in, things you look for is discharge, is there odor, does she have any lesions, bumps, anything in the internal part of it, what's her bleeding like, when's the last time she had her menstrual period, is the cervix midline, you check all of that stuff. Discharge note, color, odor, size and shape of, her cervix. Is it round? Is it oval? Then you do a rectal vaginal exam as well. You tell them what you're going to do. You tell them they may feel an urgency to have a bowel movement. You have them breathe in slowly. Let them know what they're doing as well. You put your gloved hands on, lubricate again. You place your index finger in the vagina, then you press the middle finger against the anus and ask the patient to bear down. That's how you kind of check. Some different things you can check is if they've got some bleeding, if they have any discomfort, and you always look around the anal area too to see if you have any lesions, lumps. Discharge. You can do the guaiac test to check and see if they have any bleeding. Other things we need to ask her is like, what's your bowel movement like? Do you have it daily? Is it normal, consistent? Any sense with urgency with urinating, anything like that? Any color in your odor, any smell? Okay. And that's basically it. Another thing I need to do is check her cervical spine, so I'll have her stand up. And you just kind of have her turn like this towards me. You just have her kind of bend, and you just kind of go down and feel if it feels like it's in line. You don't feel any abnormalities. You can ask her to bend forward. How far can she bend forward and touch her toes? She can do that without difficulty. She doesn't have any problems with that. Her lung sounds were good and clear. Her heart rate was normal. Her capillary refill was good. Skin color's good. Other than the abscess on her buttocks that she has, which obviously we won't, for this video purpose, have you look at it, but she said it's reddened with some area. It's hard. She doesn't have any drainage. It's warm to touch. And of course she's been on antibiotic therapy for that. They did lance it and also recommended that she soak in how much Clorox water, a bathtub for 10 minutes.